In its most basic form, it's an online questionnaire, if you like, in its most basic form. And there are organisations that have been really unskilled in terms of how they measure themselves, and they just want to know exactly where they sit against the benchmark at the time. So there'll be really quite rudimentary questions around how they're doing, how they're performing, what skills gaps they feel they have, and we'll ask the same questions of people that work alongside them, and you very quickly form a picture of how they're faring. So at its most simple level, there's just some very robust but validated questions. I do emphasise that everything we do is validated by panels of advisors and experts, so that you just understand very quickly how you're doing, and moreover, how your colleagues and patients think you're doing. That's really important. There can be a gap between how you think you're performing and how the rest of the practice, the surgery, the organisation, the hospital think you're doing, and that's really fascinating. And sometimes it can be either way. So in a new organisation, you might think you're not doing particularly well, but hey presto, the results come back and it's really satisfying, because actually people think you're doing a damn good job, and that's brilliant. And that's often the case. I think over time, Premier IT systems will help overseas organisations get to the standard and the levels that we are here, because you don't have to annually appraise. You can run appraisals quarterly, and some organisations do. Some organisations are fascinated and passionate about appraisal, so they can be run more often. If you get the buy-in and motivation very quickly with the workforce, it can be really, really satisfying. Yes, you'll have the outliers that simply, for whatever reason, don't engage very quickly, but absolutely the vast majority, and I'm talking 90% plus, will really want to understand how they're performing and how they get better, and moreover, they'll want to be able to prove to their patients and the public that they're high performers. We work with most of the teaching hospitals in the UK. We work with most of the medical royal colleges. We work with NHS England, Public Health England, etc. And these are organisations that are fairly complex in nature, but because the system's online and so comprehensive, and because we have a series of user groups that run on a quarterly type basis, we can really tune into what the needs of an organisation are, and the systems are sufficiently configurable that actually we can switch on and switch off elements of the system so that it actually becomes your system. So if it were provided for NHS England or an overseas organisation tomorrow, I'm confident that there would be the adaptability, the configurability within the system now to get that tool absolutely spot on for that market needs very quickly. I'm talking days, even days rather than weeks, because they're so configurable now. We've been doing this for 10 years plus, so the systems are sufficiently wide, broad enough that we can just simply narrow them down. So if you're absolutely brand new at this, we can give you a pretty narrow system that you'll feel confident with very quickly, and then we'll start opening the offer up as your skill levels improve and your confidence improves.